Hello, my name is Simran, and today we will understand depression in adults. We will look into introduction, primary care depression, causes, symptoms, variability in the symptoms, treatment. Is there any relation between depression and obesity? Depression in men, and conclusion. To begin with, let us talk about what is depression exactly. Depression is a mood disorder, the feeling of sadness and loss of interest. It can also be understood by the term depressive disorder or clinical depression. Depression can happen at any age but often begins in adulthood. And I'd like to believe most of us would agree to that because adulthood not only brings a lot of changes, it carries a lot of responsibility and uncomfortable situations we have to face. According to WHO, depression is the main cause of disability throughout the world. Does childhood trauma result in depression? Yes, it does. So why don't we imagine ourselves as a 5 to 6 year old child being witnessing a situation where there's a lot of abusive things being shared in family or society? It does leave a trauma, and that does lead to depression in adulthood. Primary care is the largest platform of healthcare delivery, and sadly, most patients with mental illness are initially present there. Isn't it important to diagnose depression because that is the only possible way we can treat depression? What are the causes of it? It is a combination of genetic, biological, environmental, and psychological factors. Can be family history, personal history, fluctuations in brain levels, environmental risk factors, psychological and social risk factors, major trauma in past or present, physical illness and medications. It all differs from person to person. One can face major trauma while other can be facing depression because of physical illness being gone through. It is just a cycle. It begins with thinking style, emotions, introspection, negative pattern, then leads to overdreaming, overthinking about it, depriving yourself of sleep, overindulging in food. That leads to exhaustion and having no motivation or energy to do something you previously wanted or previously had interest in doing. What are the symptoms? Drinking, smoking, loss of appetite, suicidal thoughts, restless behavior, unable to concentrate. All of these again differ from person to person. Variability in symptoms. It is a situation where where a patient shows a large amount of improvement in symptoms just with one session, and that leads to treatment resistant, and that is basically a condition in which patient shows no improvement further. Obviously, there are ways we can prevent it, but it highly depends on the state of patient. Treatment: internet delivered behavior therapy, face to face cognitive behavioral therapy. And given the times of COVID, internet delivered therapy has come to the rescue for all of us. Is depression linked with obesity? Obesity and depression are prime health concerns overall the world, especially when they co-occur. However, there is no valid database or statistics that prove that they have entirely linked with depression and obesity. But rumination plays an important part in the cases. The power of thinking is very important. So why not change it to positive? Depression in men. According to Mental Health America, there are 6 million men suffering from depression. However, they won't speak about it because of our idea of how masculinity should be presented. It can often lead to antisocial behavior and suicidal thoughts. The definition of masculinity is so orthodox and has become extremely toxic in our society. Depression does not ideally match the idea of disease because we tend to give more importance to physical wounds than mental wounds. It is important to have stable and balanced mindsets. It does not happen overnight, so be patient with ourselves and others. To be aware of the surrounding and the symptoms, and to accept the fact that one can suffer from depression. Thank you.